I see a lot of familiar faces here tonight. Welcome everyone to our panel session. For those of you that I don't know, I'm Brian Cameron. I'm the Executive Director of the Center for Enterprise Architecture in the College of ISD. And this evening we have a unique panel discussion in store for you. You know, the issues plaguing the Federal Affordable Care Act website are well known. The website rollout in many cases was a textbook example of what happens when enterprise architecture practices are not properly employed. So tonight we're pleased to present a unique panel discussion on the ACA website and what good enterprise architecture practices could have brought to the website development and design process. We've assembled an expert panel consisting of people with in-depth knowledge of enterprise architecture and how enterprise architecture was applied to the ACA website at the federal and state exchange level. Through this discussion, we hope to provide a better understanding of what went wrong and some examples of bright spots as well, some things that went well, especially within the state exchanges, and what enterprise architecture could have brought to this process had it been maybe more properly employed earlier in the process. So the format for tonight's discussion will be as follows. I will briefly introduce each of the panel members. Each panel member will then speak for 10 minutes. Then we'll open the discussion up for a question and answer and try to conclude within an hour, or we can go a little longer if we need. So let's get started. First, I'm very pleased to present our first panelist, Mr. John Dodd. John's the Principal for Government, Health, IT, and Enterprise Architecture with Computer Sciences Corporation. John is creating service offerings and strategic partnerships for major transformations programs with organizations such as the Center for Medicaid and Medicare and Medicaid Services, state health and human services programs, and defense health agencies and other government agencies. He's aligning those service offerings with global health practices and big data analytics practices. Mr. Dodd previously was the lead with the Healthcare Quality Information System Initiative as chief architect, and he's created an architectural approach that's used by all state Medicaid programs and has consulted with those states and supported architectural programs around the country. So John's been a great friend to our center as well. The only negative thing I can say about John is that he's not a Penn State grad. You're a Maryland grad, right, John? But he's been such a resource to our center that if anyone's worthy of an honorary degree, it would be John. Our next panelist is Chris Marshall. Chris is the Senior Managing Consultant with the Public Consulting Group, and she's spent the last 2.5 years working with state-based exchanges across the nation, examining their enterprise leadership structures, management practices of each marketplace project, in addition to performing many types of technical analysis in all phases of the systems development lifecycle with various state exchanges. Chris has over 7 years' experience leading online systems development with health and human service areas across the country, and over 8 years' experience leading development of state and local complex systems. Chris is also a soon-to-be Penn State grad. She's actually a student in our new online professional master's program in enterprise architecture and has written her capstone thesis paper on the ACA website rollout and the architectural problems associated with that rollout. Our next two panel members are also not Penn State grads, but if anyone's worthy of an honor, sorry. But if any two individuals were also worthy of the honorary degrees, it would be Len Feskins and Nick Malik. Let's start with Len Feskins. Len is the chief editor of the Journal of Enterprise Architecture with the Association of Enterprise Architects. Len's been employed in enterprise architecture in various senior roles with companies like Hewlett-Packard and others since the 1970s. Len is one of the leading advocates for the profession in his role with the Association for Enterprise Architects. And Len was a supporter of our program at Penn State before there ever was a master's program or Center for Enterprise Architecture. Without him and the countless hours he's put into our center, I don't know where we'd be today. So when we're handing out the honorary degrees, Len Feskins would definitely be at the head of the line. And I'm going to personally thank him right now for all the time he's put into our efforts. Nick Malik is the Enterprise Strategy Architect for Microsoft Consulting Services. Nick's a very well-known speaker, author, blogger in the profession. He's got over 30 years of experience in roles ranging from product development to consulting, and now Nick finds himself providing enterprise strategy consulting to companies all over the globe. Nick is also a very active supporter and proponent of advancing the profession. He's involved in many professional organizations, and I don't how you find the time to do everything you do, Nick. Nick and I actually recently collaborated on a common and perspective paper on enterprise architecture. And he and I worked very hard to get over 17 professional organizations from around the globe to come together to agree on a common definitional document on EA and the value that it brings to organizations. And I think in some way, Nick, we have a small feel for what it takes to get legislation through Congress. A lot of negotiation and long hours and conversations. But without Nick's tireless efforts, this project would not have been a success. And Nick and I are still speaking, so I consider that to be a successful process and project. So I want to thank him for all the work that he's done. So from here, we have a progression to our panel session. We're going to start with John Dodd. John's going to set the stage for the discussion by giving us a great overview of the size and scope of the issue we're talking about tonight from a federal and state level. He's got a perspective that's going to cover the state and federal exchange efforts and highlight not only the issues, but also some of the bright spots that are seen around the country with some of the state exchange efforts. Next, Chris is going to give us a perspective of somebody that was in the trenches and worked on various aspects of the ACA website rollout and has a lot of in-depth knowledge of where things went well and where things went wrong from an architectural perspective. Then Len Feskins is going to build on what John and Chris have presented and discuss how many of the issues with the ACA website rollout are common to large complex systems implementations and what enterprise architecture has been proven to contribute to the design and development of such complex systems. Then Nick Malik will continue to discuss the benefits of properly employed enterprise architecture with some examples of where EA has provided value and has been used effectively. So let's get started. Turn things over to John. Good, sure.
So I have to confess, as a kid, I was grew up playing football in Pittsburgh, and the coaches were all Penn State former football players. And so we learned, and this was so old, as Rip Engel was the coach of Penn State, and I was learning the plays from the Lions, the Nittany Lions playbook. But I went from Penn State to New York, from Pittsburgh to New York, and I went to Maryland. But I enjoyed, and my family had lots of Harrisburg relatives. There's a relative that was the chief cop at Penn State, Bill Pusey. So I do have a lot of connections, and I know my way through the valley. Healthcare at the time when the Affordable Care Act was written was recognized as a broken process. And I'll talk about that. And so part of this might be, and I talked to Mike Smoyer about this, the process that went through the legislation. So I was working at the Office of National Coordinator of Health IT, which was formed 10 years ago under George Bush to address health IT as an enabler of technology there. So I was brought in there because they wanted somebody with an integration perspective. So I worked on integration projects from the Apollo project through the air traffic control system, to the space network, to all the intelligence systems. And on and off, I was going out to get a medical informatics PhD, which I never completed. Probably because I had all these other day jobs. But it was recognized that the healthcare, the Affordable Care Act is large, as you may know, and it has many sections on it. And one of the sections is the sections on consumer information insurance oversight. And it talks about how to get the care to how to get more people to sign up. And in the state of Massachusetts, they had a marketplace. Okay, so they said, well, we're going to get the market to provide this. We're going to have people register. We're going to have those capabilities. And the theory was that we need to get improved healthcare in a number of ways. So it had to get more people registered, and you had to get healthy young people registered, the old people, and over a certain age, unfortunately, you almost all have a pre-existing condition. Now, you probably don't because you're too young. But anybody above a certain age has a pre-existing condition. And this healthcare was running with that as a premise. And so they could jack up. My 60-year-old sister-in-law had 5 pre-existing conditions and had to pay $1,800 a month. Okay? And her husband had to pay almost the same. Now they get a subsidy and it costs them $38 a month. they can live because they only make $40,000 a year. Now, they are the furthest right of the right and live in South Carolina. They had a hard time getting on the website. But they're people that you're looking for because you want to move care to prevention. You want to move care so that people don't go to the emergency rooms. So there's lots of reasons for that. So we have the best in the world. We have world-class research, but we have other people that don't get care at all. As I know, having played rugby in college without health care, when you get your face kicked in and they're thinking of sending you to the emergency room for brain surgery, and your parents are in New York, and they don't know you have been playing rugby because you didn't tell them, you say, now if I have to die, call this number. But otherwise, I don't want them to know. And so years later, I was telling my sister, and she says, what did mom and dad think? They never knew. But I know there's that fear of, and then later on, I didn't have health care for a while, and they said, well, you have sinus problems. Did you break your jaw at your cheekbone? Yeah, I broke both. Well, how was your head? Well, it looked like this strange guy. So when you don't have health care, you do strange things, especially when you're young, invincible. So we need to get that. So that was part of it. We also knew that every other industry has started to make electronic progress. Hospitals were never automated. Or if they were in one department. Okay? Cell phones, banking, they all went through that phase. So the ARA HARTECH Act has now got 90% of the hospitals in electronic health records. States like Maryland have all the hospitals connected. States like New York are all connected. Now, if I have a heart attack at home in Maryland, and I go to the Albany Project in New York, I'm not sure I can get connected. But that's how it should be. They should be interoperable, should be better analysis of data. Okay? And how does should that happen? Well, you should go through a phased process. Architecture can be key. You can get the vision of where it's going to go. But the architecture problem, for at least that portion of the Affordable Care Act, was not addressed. Now, the architecture portion for other parts, like collecting, every other industry, they score how the consumer gets hospital data, provider data. Now, that was done with an enterprise architecture approach. I was the chief architect, we did that successfully, shared services. Now we collect data on every ambulatory surgery center, cancer hospital, we collect data. They never collect, if you can't collect data, you don't know where it is. Okay, so one of the problems was, this was formed as a separate organization called it was called the Office of Consumer Information and Insurance Oversight. It was put outside of CMS in Bethesda. They were going to do their own thing. Innovation was going to be the key. They didn't need all this highfalutin things, even though one of the people that was presenting there, who Congress reeled in, he said, I want an integrator, I want this architecture, but he was a lone wolf, a lone person in that organization. And so what I see is many of they did do some of that, because they had a process that was used by states. So the states got together and they did create a basic architecture. We won a contract in New York, and we were successful in putting up the state marketplace. It was work from the day 5. It worked very successfully. But the problem is you don't get much publicity when you're working. Okay, but we need a new approach. And the new approach should be an enterprise architecture-driven transformation roadmap. And actually, I've convinced Brian, twisted his arm, that this is a key theme. And we need to take a broader approach to that. So there are lots of barriers for it. The politics was one of the barriers. Putting it in a separate organization, the acquisition process. Guess who was the low bidder? Okay, low bidder is key. Doesn't have to be best value. I was actually ran the team that lost. So that may be good in the long run. It kept me Yeah, okay. So we assumed, and I said initially that 26 states would be part of the federal exchange. And the other company said 5 states. Well, and you assume how many insurance companies are going to be in each state. Well, 26 is a lot more. And our company said, we're never going to get this. They're going to be low bidder. They said, well, we got to keep at least 50 or 60. So we had much more cost. And I actually was told we need to put in more integration cost. And I believe that. But of course we lost because they wanted low bidder. And we had done the Part B in 2004, and it worked, and we were the integrator. But the government decided to do the integration themselves. So this first wave of system problems occurs in many industries. You put in the building blocks, there's what I call technical debt. There's problems. Okay? They never going to have it right and perfect the first time, but it's got to fit better. It's fit better in certain states. And then you have to go to what I call the next wave, addressing interoperability and analytics. And finally, you see places like the NIH Clinical Center. If you go through a clinical trial, they have the most advanced system. They know your electronic health record. They know what medication you are on, the genetics. I mean, there's systems out there that are great. Okay, someday we'll have that personalized medicine. They'll know my genetics, my problems. They'll know which medication I need. That's the vision of the future. But we need to create what were the problems of the first wave. And there's a number of problems. There's a number of successes. And we have to figure out where to go from here and address those, and especially making sure that all the information about you, your family, you control. Okay? And so this is very important. And so I have things about how to create that, how to make it more performance-driven, how to bring about the enterprise architecture discipline. It needs this discipline approach. It needs more visibility. Okay? So I have ideas on how to do that. Those information has to flow. It has to be, and this kind of looks like one of the problems they had. They did not know how bad the system was. They did not have it integrated. They had 55 contractors working on the problem. Now, in other places, they put a person like me, not just an old guy, but a guy who's been around lots of these systems. They say, you're in charge. You fix these problems. You tell us what it is, fix it. They did not have it integrated. They had 55 companies, small businesses. Now, small businesses kept getting more money. Okay? In New York, we told them in May, well, we want to add more capabilities. We said, we can't add more capabilities. It's too late. It's called the mythical man month. We can't add more people. We did add 10 or 15 people looking at performance, but not 55. We said, okay, other capabilities we've done in November, December, January, through March. Now, if we had added the 55 in June, I would have made a lot better bonus. But we never delivered anything. So you have to have some people that stand up to them and say, no, we can't do that. You need to have an approach that looks at healthcare as a business strategy. And it has to look at an architecture from a business point of view. How are we going to improve healthcare? How are we going to get to actionable results? Okay? So they were driven by innovation. So the CTO at the White House was a business guy. He had invented a company called Athena Health. He's more money than lots of you, well, I will not say all the people in the room, but he's got a lot of money. But he thought innovation would get there. Innovation alone doesn't get there unless you don't have a platform and a system that works. And so I think what we need to do is the next step is that healthcare has to reach out to the customer. You, many of you, the ones that get to Medicare, the ones that unfortunately don't have to go to Medicaid, the ones that want an insurance policy, you have to have information. And it has to be protected information. Okay? So we have to have an approach CMS did have an EA. It is very internally focused, not externally focused. It has to be focused on you, the citizen, you, the policymaker, you, the people, on how we deal with populations, how we deal with people that come from inner cities, people that come from rural areas, people, those like, so it has to have a different approach. So with that, so it is a complex problem, probably the most complex we have. It takes almost 20% of our economy. We have to reduce the cost by 30%. The fact is, it's probably 30% ineffective right now. Because people get multiple MRIs they don't need, medication they don't need. So how would EA really help that, and what did people see in the field in the States? So Chris could answer that question. Okay? Oh, by the way, so we have a book. So somebody wants to write a chapter. Brian, I need some chapter writers. Like David Lincoln back there.
You want to maybe mention about the book?
Yeah, so the book, the theme of the book is this idea of healthcare needing a visionary transformation roadmap, an approach. It's going to be a 10-year or more journey. So one of the problems is taking it on a political cycle is that it becomes a political 2-year get it done. Okay, this is a 10-year or more cycle. The modernization of IRS took a 10-year plan and took 12 years. Okay, FAA took the same thing. It's going to take some time. You have to put it out, and you have to get people to do work in a fact-based organization, not a fact-free organization. Congress actually happens to be a fact-free organization. And you guys, enterprise architecture, have to make it fact-based and very pragmatic politics, which we don't have today, right, Mike? Okay.
Thanks, John. Chris, what's your slides loaded?
Good evening, everybody. My name is Chris Marshall. I'm a senior managing consultant with PCG Consulting Group. I'm going to do something that I haven't done in a very, very, very long time. I actually wrote a speech. So I'm going to give the speech, and I'm going to do it for one primary reason, and that's because I talk a lot. And I'm trying to make sure I fit within that 10-minute time frame. Okay, so hang with me for a little bit, and if it gets too bad, throw something, but not anything sharp or utensils or anything like that. Okay? Okay. So deciding where to start in this conversation is a tough call. I figured the best place to start is to explain a little bit about the services my organization and our counterparts have provided at the exchange level. My organization provides a fairly substantial amount of services to our growing client base, and the services that have been procured most often by exchange clients has been IB&V services. IB&V stands for Independent Verification and Validation. I will ask, has anybody heard of IB&V before? Okay, the fact that you haven't thrown something at me and you've heard of IB&V, I greatly appreciate that, because most times when I say IB&V, people throw things. And one of the comments that I had a couple of months ago from a development manager was that working with me was worse than being audited by the IRS, which I thought was weird, because what I had to say, I didn't think it was that bad, but apparently, according to him, it was pretty bad. Let me see here. Sorry, I lost my place. I ask this because typically when a state uses substantial government funds, they're required to have oversight vendors, and IB&V's role on a technical project is to assess the performance of the project from both the technical and project management standpoints. This also necessitates the need to understand and evaluate the organizational structure for a substantial contribution to the assessment of the project structure. Herein lies the true ability to see and interpret the successes and the failures of the exchanges, both at the federal and state level. Having said that, let's talk a little bit about the exchanges themselves. Right off the bat, we can talk about terminology. Most are aware that the exchanges were deemed the flagship of the ACA law, as it is the conduit or portal that is used to provide access to private health insurance. More appropriately, QHPs are qualified health plans. The term exchange was replaced in the development cycle, late in the development cycle, by the term marketplace. To make this conversation a little bit easier, the difference between the two, in the way that most vendors will interpret this, exchanges are the actual people. They're the organizations that actually put the marketplaces together. The marketplaces are the actual technologies, if that makes any more sense. So there are a couple of different flavors of exchanges. There is the state-based exchange, which will be the foundation of the majority of today's conversation, and then there's a federally facilitated exchange. State partnerships are very similar to state-based exchanges, except for the fact that they don't have their own technologies. They're actually using the federally facilitated exchange. Primarily, their offerings will be more on the marketing side and also for outreach purposes. So on this screen, this is a rather crude example for interpretation of what a marketplace is. Regardless of the type of marketplace, the overall structure resembles this process: a single access point that controls data from the consumer, cross-references against the Federal Data Services Hub, and returns results based on the information collected, allowing the consumer to apply for coverage. This is important to note, as the common component between all marketplaces is the Data Services Hub, which I'm sure if you follow the ACA, you've probably heard a lot about the Data Services Hub. So here's what we know. We have an organizational structure, the exchanges, producing portals, marketplaces, using a common component, the Data Services Hub. Now, if you're thinking single point of failure, you'd be correct there. It kind of is. And indeed, the pains that were associated to slowness, errors, and inability to process an application in some instances shortly, at the point of go live and shortly thereafter, can definitely be attributed to the Data Services Hub and an inability to perform correctly. So, let's turn to what went wrong. And I kind of like to mention these as the tangibles, because these are the items that folks, consumers, actually really did feel. And it's a little bit different than what we as technical professionals feel or experience. There are many different ways and degrees at which we can have this conversation, but let's focus on some of the primary concerns, which are quality, capacity, and performance. And let's be on the safe side, let's talk about security, since nobody really wants to talk about security in the ACA. Quality is a concern. Well, honestly, quality is a concern because the industry, and I'm sure others close to or in exchanges, would venture to say that more testing would have prevented the errors that plagued marketplaces for months following go live, which is true, not true, but a lot of testing obviously would have helped them greatly. And then there's also the speculation as to code quality, which is also an interesting conversation to me because it depends on what your expectation of that code is supposed to be. Now, I've had this discussion with numerous people in the past, and anytime somebody talks to me about code quality, I always ask them what they mean, because you can mean a lot of different things with code quality. If you look at Microsoft and Microsoft's history, and you look at the size of that operating system, you have to ask how much of Windows 3.0 you're still carrying. Right? I mean, that's valid, right? But technically, Windows 8 works, technically. There are definitely quality, capacity, and performance issues. People couldn't get into marketplaces to browse, much less apply. And though each exchange had to pass a number of security measures, this is including NIST compliance, there were a number of concerns related to availability of personally identifiable information. Now, to date, no breaches have been formally reported, but a number of agencies, independent agencies, have reported vulnerabilities. These are the tangible concerns. For our purposes tonight, it makes more sense from an enterprise architecture perspective to talk about the intangibles that contribute to these issues, all of which I believe are related to line of sight. So these are the intangibles, the things that as professionals in the field, we feel most greatly. I don't know if any of you actually watched any of the legislative hearings or the federal or state legislative hearings. I watched them because I'm kind of weird like that and I found them interesting. But I realized the majority of Americans, it's like watching paint dry. So if you didn't catch it, I understand why. There was a very common theme that was discussed in every single hearing, and that theme was related to whether or not the exchanges were flat out lying, or if the exchanges just didn't really know. I think the answer to this question lies in the organizational structures of the exchanges. And my primary speculation here is that exchanges may not have been structured in a manner that would have provided definitive answers. State-based exchanges, by law, are defined as organizations, basically businesses that will eventually become self-reliant, as in not dependent on federal funds to operate. This process will begin in 2017. The exchange organizations I've witnessed appear to be largely staffed from public agencies, as in folks with backgrounds in government policy and the way government currently does business, not the way that government probably should be doing business. Though there are exchanges that did appear to have a hybrid mixture of both public and private resources. So what does this mean? It means that exchanges were responsible for building a business at the same time that they were building a complex solution. The federally facilitated exchange did not fall under the same business requirement. However, the agency that was responsible for the development of the federally facilitated exchange was also responsible for the development of the Data Services Hub, as well as the oversight and management of each state-based exchange, not to mention dissemination of policy, regulations, and Medicaid expansion. So it's fair to say that regardless of the type of marketplace, each marketplace had a large mountain to climb, many rivers to cross, et cetera, et cetera, et cetera. I view this as a contributing factor, actually the number one factor. The items listed on this slide, yes, the items listed on this slide are indicative of those intangible items that are more apparent to folks on the ground within each exchange, the folks in this room and the industry itself. These are intangibles, are expressions of an organization's maturity, but with regards to exchanges to date, the greater concern is the ability of senior leadership to see across the organization, to work to resolve inhibitors and make accurate, informed decisions. And keep in mind that in order to build these exchanges, in turn, marketplaces, most environments operated in silos. And each of these silos worked fairly independently until several months prior to go live. So if you've got all these different verticals running at one speed, and they're all running fine, and they're all happy in their own little worlds, and you try to merge them all at the same time, and you give them that much time to do it, you're going to hit a number of errors or problems. There's going to be noticeable gaps, and oftentimes a business challenge or a policy challenge will become a technical challenge, so you've changed your scope. An example of this was a fairly late decision by the Federal Exchange to require consumers to create an account in order to browse plans. This resulted in a huge hit to the Data Services Hub, causing a tremendous amount of frustration to consumers trying to purchase insurance. Should the technology have been capable of handling the change? Arguably, yes. Was there accurate information with regards to capabilities known to the groups making these decisions? That's the unknown. So this next slide, I'm going to actually read this to you verbatim, because out of everything that I can probably say today, those are probably the two most important points. The critical component that was absent from the initial rollout was not the absence of technical knowledge, but the absence of enterprise architecture and leadership perpetuating the lack of vision that could have identified deficiencies. Effective execution of EA could have fulfilled a substantial role in mitigating the complexity of overwhelming change. And exchanges share one common goal. Though some position themselves more proactively or strategically and worked to mitigate barriers and inhibitors from their environment, they experience the same difficulties that their EA challenge counterparts experience. EA-enabled exchanges, however, consistently found ways to mitigate those challenges by leveraging their organizational structures and their resources. One of the prime examples of this, as John had just pointed out, was the dilemma over the SI and the decision whether it was intentional or not that CMS, the agency that led the federally facilitated exchange, whether it was their intention to be their own SI or not, it was, in my opinion, from an enterprise architecture standpoint, a bad decision, because the experience to do so, which is a very, very experienced task, was not there. Had EA been formally present, which to a certain degree EA is present in CMS's environment, I think that it would have actually drawn on that experience and probably let people know that that's probably not the best course of action. And the part of me that struggles the most with even making that statement is there were very clear indications that enterprise architecture was there. If you look at, there's a report by Gal. If you look at the report, it clearly states, I think, about 5 different vendors that were enterprise architecture vendors. Being a vendor myself, specifically an IBM vendor, I can tell you everything that I see is wrong, and I can tell you everything that I think you could do to possibly fix it. It's still on your honor to fix it. So there's nothing I can physically do to you that's going to make you fix it, unlike the IRS. They can do things to you, I can't. So from that standpoint, it could be that maybe there was a lack of understanding or a lack of communication or adhering to what enterprise architects were trying to communicate. It's hard to say. I don't know that we'll ever really get a clear understanding of that. So in closing, where do we go from here? There are a couple of things we need to keep in mind, specifically with EA and the role it is still left to play. Firstly, marketplaces will continue to evolve for the next 6 years as they have been provisioned by the government to do so. There is still functionality that is scheduled to be released, and indeed, similar issues will still be important factors for each implementation. Finally, this is a somewhat unparalleled national initiative. It is a huge, huge initiative, something we have never actually done before. And unfortunately, because of the poor rollout, we are having a hard time being proud of it. But I think even with the poor rollout, we should still actually really be proud of it, because we motivated our government to do something unlike anything they've ever done before. And sure, I mean, yeah, they fell a little bit, but to a certain extent, there has been a formidable recovery. There's final point. This will be the end. I believe that the ACA, specifically the marketplaces, will likely not be an anomaly. I think that it will be a departure from the processes that our government has done in the past. And I think that it will be the driving force or the impetus to get us to change. And maybe it's a process, like Brian was saying, of getting us more involved. I know that there's been a lot of discussions at the federal level about switching out individuals and taking professionals that are technical professionals in government right now and putting them in the private industry for a few years and bringing them back, which is great, because yes, that will improve their skill set. But if that leadership component isn't there, it's like the whole concept of I want to develop an agile, but all my processes are in waterfall. It's not going to be successful. So until we change that platform and until we change the logic behind it, we're going to be stuck in the same place. But hopefully this will be the impetus to get us to change, which is always a good thing. So in that sense, falling just allows us to get back up. Right? Thank you very much.
Thanks, Chris. Okay, thank you, Chris. Now we'll move on to Len Feskins. Get you loaded here.
Start with a question. How many of you all are enterprise architects?
Depends on the definition.
Let's not go there. Okay, it's a very small number, and several of you have heard me speak before, so you know I take a fairly unconventional perspective on enterprise architecture. The rest of you who aren't enterprise architects don't know what an unconventional perspective might look like, so I'm going to get away with this. So I want to shift gears a little bit and talk about major initiatives in general, which ACA was a very typical case, and why things typically go the wrong way, even when there's a major commitment to enterprise architecture involved. I think the underlying reason has to do with what it takes to be successful. In a really big initiative like this, there are two things that you have to get right. You have to design the thing that you're going to build right, and then you have to design the program to actually build the thing based on that design the right way. Both of those are enterprises. The thing you're building will be an enterprise when it's built and operating, but the process of building the thing is itself a major undertaking and constitutes an enterprise. So these two things both have to be successful, and their enterprise architecture and program management are, in a very strong sense, duals of one another. They're two sides of the same coin. And if one fails, the other one can't make up for that failure. You can have a perfect design and fail catastrophically in trying to implement it. You can have a perfectly run program that implements a flawed design. In both cases, you're going to end up with a failure. And when both things go wrong, you're really screwed. So this is the fundamental idea behind why I think major initiatives fail. So I think the problem we've had is that we often adopt an inappropriate concept of enterprise, and we often adopt an inappropriate concept of architecture. I'm going to talk about both of these in turn. What I mean by inappropriate is that they're not well suited to delivering on the required, desired, or promised value. That is, they're not designed for making the effort successful. So I think the reason many enterprise architectures don't succeed is simply because they employ a concept of enterprise architecture that's not designed to be successful. I've had a lot of pushback from some people about this idea because they say, well, enterprise architecture is a kind of design. All design is goal-driven. Therefore, if it's goal-driven, it must succeed. There's a colossal amount of evidence that indicates that that's not the case. I mean, we have goal-directed programs, major design efforts that fail all the time. You really don't have to go looking hard to find examples of them. I lived in Boston during the period when the Big Dig was undertaken. And I think the overrun on that project was several 100%. I mean, it was just an enormous disaster. And they were very clearly very goal-directed. I mean, they knew exactly what it was they wanted to accomplish. They just had a hard time doing it. So there are no guarantees of success, but there are some things that you can do to increase the likelihood of success. This has led me to an unconventional conclusion about what architecture is about, that the primary role of architecture should be to design for fitness for purpose, that is to identify everything that is necessary for making the program successful. And that architecture isn't just applied to things, it's also applied to processes like major programs. That is, as I said, a program is itself an enterprise, and enterprise architecture can be applied to the design of the program. If you don't design the program to be successful, you're playing fast and loose with the odds of actually being successful. Now, part of the problem that we have with the reason we get to this disposition about people having inappropriate ideas about what enterprise means and what architecture means is that there's a strong contingent within the community that believes we should just adopt these concepts from other disciplines. And we don't have to think a whole lot about whether or not that's appropriate. It's just obviously the right thing to do. One of the most obvious is, well, people saying, well, we know what architecture is. Architecture, we just take the idea of architecture applied to buildings and we apply it to enterprises. Well, you know those SAT analogy things that you do? That's sort of like saying, well, building architecture is to enterprise architecture as buildings are to enterprises. Well, compare a building and an enterprise. I mean, they're qualitatively different things. And the idea that concepts of art, I go crazy when people quote Vitruvius. I mean, here's this guy who was talking about buildings back in ancient Roman times. And some people saying, well, his idea of architecture, we should just apply it to modern, huge undertakings like the ACA project. It's really interesting to go read Vitruvius's book, the 10 books on architecture, because the single line that people quote is literally 2 or 3 words out of actually 3 words out of the entire book, which never says anything about that again. It's all about how to build armaments, how to find the right clay, don't build your city near a swamp because there are miasmic vapors which will make everybody sick. And the idea that this little statement, which was literally a throwaway that he put into this book, somehow should serve as the basis for our concept of architecture as applied to modern enterprises is just crazy. So I've taken the perspective that we should really be thinking about the use of the word architecture as a metaphor, not as an isomorphism. and that we should design a concept of architecture that's appropriate for what we wanted to do, what we wanted to do for us. The other thing is the idea of enterprise. Within the enterprise architecture community, the word will come to be interpreted as almost synonymous with large commercial business. And that's not really what it means. An example I often use is they didn't name an aircraft carrier Enterprise or a space shuttle or a starship in the Star Trek franchise Enterprise because they were thinking about how wonderful it was that people built large commercial businesses. I mean, you're never going to see an aircraft carrier named the USS Business or the USS Large Commercial Enterprise. The reason it was called Enterprise is because it means a substantial, ambitious undertaking. And that's what enterprise really means, and that's the way we ought to think about it when we think about enterprise architecture. Thinking about enterprise as being synonymous with a large commercial organization leads to some really serious blind spots. And in particular, one of the blind spots that it led us to, in this case, was failing to think that it was appropriate to apply the concepts of enterprise architecture to the design of the program, rather than just the design of the thing that the program is being executed to implement. If we had designed the program, we probably would have had a much greater chance of being successful. How many of you saw last week's issue of Time magazine? There's a big article in there by Stephen Brill about what happened in the rollout of the ACA. And one of the things that struck me as I read that article was this was a colossal failure of program management. Yeah, there were a couple of things in the architecture that they didn't get right, that they could have done better. But the real reason the program failed was because the program management was abysmal. And there are several aspects about why it was abysmal that would have been addressed had somebody taken the time to think of architecturally about the design of the program as a whole. Another problem we have with the way that people think about architecture, and this largely flows from the idea that the architecture of enterprises is just like the architecture of buildings, is that architecture is really about structural modeling. And when you talk to people about what it is that architects do, especially in the enterprise architecture community, a lot of them will say, well, we build models. And in particular, the way we represent those models, which is usually using boxes and lines, kinds of diagrams, leads us to think that the things that we are modeling are structures, and therefore the only thing that we need to model are the structural aspects of the thing. Well, if you think about it a bit, and if you think that architecture is really about fitness for purpose, it's pretty clear that there are a lot of non-structural things that are essential to achieving fitness for purpose. And in fact, the program itself is not a structural thing. It's a process, and some aspects of it are structural, but there are a lot of aspects of a program. In particular, the thing about an enterprise is that it involves people. And the thing about people is they don't behave like the other components in systems. If you take the people out of an enterprise, all you have is a pile of capital, which can't do anything without the people there. So there's a lot of stuff that people do, a lot of things about the way people behave that are critically important to the success of the thing being designed and the execution of the program itself. And if we don't take those things into account, in particular, a major aspect of the way people behave has to do with the culture that they're part of. And if you don't design for the culture within which you have to execute the program, you're absolutely guaranteed to get into trouble. So a couple of folk tales that I find useful for enterprise architects is the cobbler's children. Okay, the cobbler made shoes for everybody in the town, but his kids went around barefoot. We don't apply architectural thinking to the design of our discipline, to understanding what it means to be an enterprise architect and what the process of doing enterprise architecture is about. The Zumbach, the tailor, this is the story about the tailor who had an incredible reputation for making perfect fitting suits. So this guy goes to him and has the suit made, and he comes and picks up the suit and tries it on, and the sleeve is too long, so the tailor says, well, just strut your arm like this. And he says, but the pant leg is right, so you just do this with your leg. And he finally gets the guy so contorted that the suit fits perfectly, and he walks out of the store, and somebody a friend of his runs into him and says, "Zumba, what's happened to you? You look like you've been in a terrible accident, but your suit fits perfectly." And we tend to do this with the models that we use. That is, we make the things that we are modeling fit the models that we are most comfortable with. And that's another absolute recipe for disaster. So tailing the wear of the suit produces only an illusion of fit. And then finally, Goldilocks. Try to find the thing that's just right. Okay, it's usually not one extreme or another. And I recently read a really excellent book by Robert Geddes, who is a real architect. I mean, he designs buildings, who's got a phenomenal set of credentials. And the title of the book is Fit. And it is all about this idea that what real architects do is also about fitness for purpose, about understanding what it is that clients want and how the role of the architect is to map that onto a concept of the building that not only fits the needs of the client, but fits within the environment that the building is sited in, and a whole bunch of concepts like that. It was a real revelation for me because I've sort of felt, I can't use that phrase, like I've been pushing on a wet rope with getting this idea about fitness for purpose across to the community about the role of architecture. And it was nice to see a real architect with just absolutely impeccable credentials pushing this idea. It's a little book. It's Princeton University Press. And if you're at all interested in architecture, either from an enterprise architecture perspective or from a general interest in building architecture, read it. It's just an absolutely stellar piece of work. So, the ultimate irony is sort of this idea that we don't apply architectural thinking to our own practice, and I think part of the reason for that is we live in a culture that values doing over thinking, especially in business context, and we try to make everything be about business. You know, as we talk about what's the bottom line. We talk about organizations that are not businesses and say, well, if they were run like a business, they'd be more successful. The only problem is typically they lose sight of what their real goal is. And they focus on being run like a business and they run themselves into the ground. And enterprise architecture is all about this holistic, integrative perspective, which is it's not either or kinds of propositions, it's how do you fit all the pieces together. So it's again ironic that the enterprise architecture community doesn't latch onto the idea that it isn't about thinking versus doing, it's about a proper synthesis, the Goldilocks idea of the right balance between thinking or doing. And I think the real challenge for great architects is knowing when to stop thinking and start doing, but that doesn't mean don't do any thinking at all. You know, don't just shoot from the hip all the time. One of the architecture groups that I led a long time ago had a saying that I've just always found really useful, that doing architecture is like spelling banana. The trick is knowing when to stop. So the other problem we have is the way we goal and incentivize our architects. And we typically goal architects to produce architectural work products, models, all kinds of specifications. And those can become an end in themselves. And if you lose sight of the fact that they're means to the end of producing a system design which is fit for purpose, then you're just basically going through the motions, and you're not going to necessarily you can say I was successful, produced all the documentation I was supposed to, but if it's documentation for the wrong solution to the problem, you haven't been successful. So what does this all mean for the practice of enterprise architecture? The first thing is disconnect the idea of enterprise from the idea of organization. Okay, organizations are a means of realizing an enterprise. And what that means is that an enterprise and the organization or organizations that are means to realizing it are often not coterminous. They may have different boundaries. And therefore, assuming that the only thing you have to architect is determined by the boundary of one single organization will often result in you leaving out really critical aspects that are necessary to the success of the program. This is a general case of this problem of failing to scope the enterprise properly. And I think it was very clear from the everything I've read about the ACA that a big part of the problem was failure to scope the enterprise properly. That is, there's a lot of stuff that was necessary for success that wasn't worried about, that was only caught at the last minute, was done, implemented in a shoddy fashion. And that, again, is a recipe for failure. The consequence of this is that anything that you leave out of the architecture is free game, fair game for any downstream designers or implementers. So they are free to make decisions which it may turn out do not result in the success of the overall enterprise because you let them basically make decisions any way they saw fit. So it's really critical to get the scope of the architecture correct because if you don't, then you run the risk of people making decisions that ultimately aren't going to result in the success of the effort. We spend too much time thinking about models and not enough time thinking about principles. Principles are probably the most important and most neglected idea about architecture that I've run into. We're starting to see a shift in the balance. Again, this is that Goldilocks thing about deriving the right balance between thinking about models versus thinking about principles. Often the non-structural things that are essential to success that are difficult to model can be very nicely expressed using principles. And then finally, remember these observations apply to initiatives, to the program itself, as well as to the systems that the program is designed to implement. We often think about enterprise architecture as comprising people, process, and technology. I ask you, one of these is not like the others. It's the people thing again. And it's probably more useful to think about an enterprise as comprising things, people, and ideas, because those really are three different kinds of things. As I mentioned earlier, an enterprise is a people-intensive system. You take the people out, you don't have an enterprise anymore. One of the things that really struck me about Robert Geddes' book was the relationship of the building to its environment, and he goes into a considerable amount of detail about the importance of that relationship and how the relationship to the environment fundamentally affects the functionality of the building as perceived by its people who live in it or work in it. We have a similar situation with respect to enterprises. If you don't take account of the environment when you architect an enterprise, you're guaranteed to get into trouble. And then finally, it's become fashionable to talk about enterprise architecture as being the bridge between strategy and execution. The problem with saying that is it's easy to think of that as being three separate things: strategy, execution, and a bridge. You can't think of them that way. The purpose of the bridge is to connect the strategy and execution into a single system. And again, this is the role of architectural thinking, is to bring that holistic, integrative perspective to the party. So the only way we can accomplish big things is to split them into pieces, both in space and time, but that doesn't mean that they're disconnected. Somebody's still got to be responsible for making sure that all of the individual pieces are connected and play together. And that's, again, one of the things that I saw as a major factor in the difficulties in the rollout of the ACA, was we had a lot of pieces and nobody who was in charge of the whole thing. One of the things that came through over and over again in the Brill article in Time was that when they investigated the effort, they couldn't find anybody who would own up to being in charge of the whole program. There were a lot of people who were in charge of various aspects of the program, but there was no single person who felt they owned the whole thing. That is an absolute recipe for disaster. And in particular, the only thing worse for an enterprise than one incompetent enterprise architect is a lot of competent architects who are working independently of one another. Thank you.
Thanks. Nick, get your swords loaded.
So I get the fun job.
You do.
So we've been talking about what went wrong. And you know, I'd be very surprised if anybody in the room didn't already have some opinion of what went wrong before you walked in the door. The challenge, though, is there's not a lot of people who talk about what goes wrong. So I'm not going to talk about what could have gone with the ACA. I don't know what could have gone with the ACA. But I can tell you some examples where EA did work. So I'm going to talk a little bit about that. Making clear that EA is not, EA is actually sometimes a useful thing to do. All right, could the EA have saved the ACA rule? Saved it. I'm going to talk a little bit about what EA is and understand its role. Because there's a lot of misconceptions and a lot of definitions, and Len is completely right about understanding that enterprise architecture is probably the worst used term in the industry. And I'm going to talk a little bit about case studies and how that plays out. So first off, the role of an enterprise architect. I've got a couple of pictures down here as well. Things they're not. But one metaphor I sometimes use is that of a doctor. In case anybody hadn't noticed, I'm a little bit overweight, which means I'm really good at ignoring my doctor. Now, that doesn't mean my doctor's a bad doctor. He's told me, you gotta lose weight. Okay? If you don't lose weight, you need to get unhealthy. Thanks, doc, and I grow up and get an ice cream. To a certain extent, the enterprise architect is a doctor. He can see what's going on, and if he can't, he'll actually do some tests. He'll take some tests and take a look at my blood sugar and all the rest of the stuff, my x-rays and all the bit of it. He'll tell me there's a problem. He'll recognize the signs of the problem because he's an expert at what it should look like, what it could look like. And then he'll say, here's my advice on how to address that problem. And I am now free to completely ignore him. And those of you who are an enterprise architect know that feeling. This organization needs to improve these capabilities. Thank you very much, Melanie Lumero. The other side of enterprise architecture is, okay, sure, I'm listening to you. We need to work on that set of capabilities. We need to do this bit. Maybe I'm going to listen to my doctor, and I'm going to take that medicine, and I'm going to go get healthy. But the doctor doesn't just now say, okay, I'm done. Forget it. No, I keep coming back. He's going to come back and tell me how I do it. And so an enterprise architecture has that role as well. Monitor the treatment. So is it making things better? Because it might not be, right? And every single individual person is a little bit different. This isn't a perfect medicine, okay? There's a couple of reasons why it's not a perfect medicine. Unlike medicines, comparisons are really, really difficult. The real reason behind that, everybody in this room, we share over 99% of our DNA. We're pretty much the same. We don't look the same to us. To a dog, we probably look the same. But the reality is that we all have kidneys that function more or less the same way, we all have livers that function more or less the same way, hearts that function more or less the same way. So you can take 1 million people and say, here's how a heart should work. And that kind of applies to all 1 million people. Trying to take that concept and apply it to businesses is a little bit like trying to compare the disease progression between a bird and an earthworm. Right? Totally different DNA, you're not going to get anything that you can compare. This is actually the downside of that metaphor. Right? EA, effective EA, helps an organization to better fulfill its mission. This is that fit for purpose that Len's talking about. So what does that mean? How do you know that you're fit for purpose? Right? Well, I've got a couple of ideas. This is actually an area of research. We're not sure that we know what it means to be fit for purpose. Okay? We're still understanding. So some of the ideas I've got up there, reduce cost and complexity, that's one that people throw out a lot. Gee, we're better if we cut the cost. Well, maybe, maybe not. That's a little bit like saying, I'd be better if I lose 20 pounds, let's cut off my leg. Okay? Demonstrable alignment to expenditures to strategy. So this can have the effect of saying, gee, I've got a bucket of money, let's make sure everything lines up to strategy. We'll do everything you said, Mr. CEO, exactly like you asked. Okay, what if you ask for the wrong thing? We can do that. I mean, hey, do you want to drive that? It's a little bit like following your GPS. Ever had your GPS say, turn left now, you look left, and you're like, that's death. So, to a certain extent, someone needs to kind of go, no, let's not follow the GPS into Lake Michigan. Improvement in identified capabilities, that actually is a reasonable way of measuring EA, right? Now, we can say, which capabilities are identified? And that's part of that alignment concept. But then, let's improve them. Can we measure that improvement? Can cannot tell you how many enterprise architects would reject that idea because it's not up to us. It's a little bit like saying, let's judge the doctor on whether or not his patients are skinny. What you'll get is a doctor who picks skinny people. Okay? So there's a certain sense that there is not a direct cause and effect. Some of it is how well you listen. And the same thing for rapid adoption of business models and improving merger and acquisition. These are very good measures. But realize that in all cases, it depends on the organization you're talking about. There's no magic answer. But the major areas of impact, once again, I'm using that same model. Analysis of an organization and then oversight governance. So I started out by saying I'm going to have three case studies. Actually, I kind of have four because the first one I've done twice. So I've got the little numbers here. I'm going to do one of them, actually twice, on analysis. Talk a little bit about how we understand what could be and how we come up with a plan. And then I'm going to do another one on architecture review, how do we monitor and oversee something that's going on, and then another one about how we come in and intervene when things are not going well. And these are areas where enterprise architects actually do succeed. Let me give you some actual examples. So first one, impact of road mapping. This is pharmaceuticals. So there's been a lot of blockbuster drugs. A lot of blockbuster drugs. And when investors sit at the stock market, they buy shares in Merck and some of these other companies. They're buying shares in how much money they're making off those blockbuster drugs. And those drugs are about to hit a rather large cliff. And that cliff is called generics. And so those companies lose a lot of revenue when a blockbuster drug drops off the cliff. You literally can lose half your revenue. If you think an organization doesn't like losing half its revenue, try it sometime. It's a real painful experience. So they have to figure out how to fix something. Competition in this space is fierce because all the different drug companies are facing this. They all have blockbuster drugs that are about to expire. And what has worked in some cases is let's reorganize the company a little bit to speed up the stuff that's in the pipeline. Because we don't know that we have a blockbuster drug, but we know that we've got 30 different things that are going through the process and we need to speed them up. So the strategy is not develop a blockbuster drug. That's a little bit like a strategy of get rich, right? It's more like, let's speed up the stuff in the pipeline. And the way to do that is to integrate your organization. So this is a big change, it's a big strategy. And in this case, we had an enterprise architect who went in and said, okay, I'm going to plan out what it means to make your organization more horizontally integrated instead of vertically integrated. And the twist is, it worked. Key capabilities were delivered earlier. As a result, the organization didn't run into the risks that would have slowed down the delivery. When was the last time you heard about a major program that delivered under budget and on time? You don't hear about the success of it, do you? That's one of the things that EA does. And it does that by giving people a roadmap that's actionable. Of course, once again, it's like your doctor telling you to lose weight. If you ignore them, you're not going to lose any weight. In this case, the enterprise architect provided a roadmap and the organization followed it. This is another example of roadmap. This is another similar case one. This is a little bit different though. And this is kind of close to home. This is actually from a friend of mine, okay? I was an enterprise architect within Microsoft, so my customer was the Microsoft Corporation. And Microsoft Corporation, 20 years ago, was unstoppable. Everybody was like, oh yeah, that's a juggernaut. We're going to break that into pieces because it's going to destroy the world, right? Remember the evil days, the Dark Empire? Right now, that everyone's like, Microsoft what? Oh, you have a phone? That's nice. So the reality is things change. They change very, very quickly. Microsoft has had to catch up. In the past, we used to buy little companies all the time. Literally 30 or 40 a year would not be an unusual situation for Microsoft to acquire 2 companies in a week. But most of the time, it was buying their IP and a couple of developers, stick it in an existing division, and throw away everything else. Literally, we didn't care about the revenue. But when you're trying to catch up, you care about the revenue. So we started buying larger companies, multi-billion-dollar acquisitions. And it started, the bigger recent one was a Quantum, and then it went up from there. Yammer, Skype, Nokia was one of the more recent ones. So just adding those 4 together, almost $23 billion. Now the processes that we have in the company for acquisition, which is buy the IP, throw the developers, and give them some shares to shut up, didn't work. Okay? Quantum was a real rocky situation. We brought them in and we said, we want you to be our search engine advertising system. So how many of you have been on Bing? Right. Did you get the ads you thought you should get? Maybe. You know, Yahoo bought it. Facebook actually uses our advertising engine now. It's successful, but we lost a lot of value. 2 years ago, we wrote off the entire acquisition from the value of $6 billion. Okay, so that I would not say that's necessarily a successful acquisition. So when other big acquisitions started coming down the line, Enterprise Architecture knocked on their door and said, "You know, we can help." And they said, "Yeah, okay, come on in here because that way we have another person to show them light." It's an organization. We're no better than anybody else. But the twist is, we developed a model and a framework for doing it, and it actually works. And in the past 3 years, we've not lost shareholder value by buying some of these companies. That doesn't mean that these are the greatest purchases in the world. I'm not going to tell you that buying Nokia was the best idea. Maybe it was. Okay? But I can say that we're not losing shareholder value by doing it. Because enterprise architecture is involved in the merger and acquisition process. Because we develop roadmaps on every single acquisition. We know when, where, how, and how much we're going to integrate each one of those different companies. And we know it that, you know, within a couple of weeks after the deal is signed. We can't do it before the deal is signed. It's actually illegal. But then the moment that deal is signed, we've got people all over each other. So it does work. And enterprise architecture, merger and acquisitions is not a space that's been frequently talked about. Right? People talk about enterprise architecture, gee, let's implement SharePoint. No, that's not it. That's good systems architecture. Let's talk about implementing the acquisition of Yammer. Governance. Len talked about principles. Len and I agree on principles to the point where it's actually kind of silly. That is the list of, and by the way, you can actually take this presentation and expand it and read it. That's actually the list of our enterprise architecture principles within Microsoft. Okay, I know that because I wrote it. Well, I didn't. I coordinated the creation of it. It took better part of a year and a half to get the entire Microsoft's 8,000 person IT organization to agree to a set of principles. And the twist is, it worked. So it's an example of how those principles actually changed the company. Okay, Windows 8. Anybody use Windows 8? Everybody heard of Windows 8? Little thing, minor release of the company. Has a marketplace in it. Why? Because Apple has a marketplace, and we have a marketplace. So we have a marketplace, and we have apps. That's cool. We have music, we have video, we had all these other things on the Zoom store. We also had about 15. I'm not making up the number. Other e-commerce marketplaces in Microsoft. Okay, and they competed with one another. And if you were smart, you could get the best price by playing them off against each other. Okay. The reality, though, is that we were going to put a marketplace directly into Windows. We were going to sell apps that were $1 a quarter, 60 cents, or whatever for a particular application. And if it costs you $15 per transaction, that's a money-losing proposition in a hurry. So we had to take 100 times the volume of our best store. So everything had to change. So we created a roadmap for that. Super, got a roadmap going. How do we actually make it happen? So in this case, we watched it. We watched every single step of it, and someone came along and said, your roadmap says I have to integrate to you, I don't want to. And we're like, okay, well, we're going to talk, we're going to be nice, we're going to be friendly. I don't want to. Okay, we're not going to be so friendly anymore. We're going to now raise this up the ladder. We raised it up the ladder to the board of directors. It became an audit item on the board of directors audit report. Okay? Think about that for a few minutes. He still said, I don't want to. You couldn't get much more buy-in than having the CFO say do it and him say no. Okay? This is where the enterprise architect made a difference. Because he went in and said, what do you need to understand this decision well? I said, well, I don't believe anybody's really looked at my team's ability to meet this need. I don't want to integrate with you because I can do it myself. I said, okay, let's come up with a simple decision mechanism. Let's come up with a governance mechanism that says, we will all agree to the results of this before we do it, and then we're going to go do it. We're going to see that those results are fair, impartial, balanced, not somebody saying, you've got to do it my way because I like it. He's like, okay, I'll do that because you felt like maybe it'll take some heat off. So the enterprise architect built that process. Guess what? He had to integrate. Okay. But because he agreed in advance, he did it. We oversaw the program, and Windows 8 has that e-commerce platform. And of all the things that you hear about Microsoft, you never hear about a problem with that e-commerce platform. You know why? The freaking thing works. So sometimes EA actually does have an effect. And in this case, it was one of these principles. Okay? Fix the process first, grow the platform. Intervention. So just like a doctor could say, you know, you gotta lose weight, but then when I show up at the emergency room, he's not gonna just stand there and go. Intervention helps. So this is a good example of a large government contract. It's facing serious problems to the point where their system integrator was very seriously about to get sued by the agency. Missed dates, way over budget. Everybody was unhappy with what was going on. Okay? So the enterprise architect was called in and come fix things. Well, that's kind of a crazy place to be. But what really ended up happening was nobody had taken a look at the architecture of the enterprise of the program, which is what Len was talking about. It wasn't the enterprise of the system, the enterprise architecture was fine. It was the program. People weren't talking to one another. They weren't reporting in the right way. They weren't taking the correct amount of ownership. So what did he do? He pulled aside the team that was right at the center of things and said, okay, you guys have seen this from the heart of it. Tell me what the problems are. Got the problems listed. This team had gotten to the point where they were pointing fingers at each other. Okay? Because they were getting so much pressure from the agency. You've got to fix this, you've got to get it done, you've got to be done now. And they were fighting amongst themselves, the project managers were fighting amongst themselves. In a large program, you can have quite a few contractors. Now, ACA had a fairly sizable number, but even 5 can end up in a situation where these people are going to kill each other. So we pulled them off into basically a team offsite for a couple of days. So what are the problems? We've got everybody to work together as a team. I'm not going to hold you blameful. I'm going to ask you what's wrong. And got them to work together as a team. Within 6 months, that thing changed. So sometimes the problem is just the people. Okay? And that's where enterprise architecture can make a huge difference. So, in conclusion, I want to talk about, answer the question, could ACA have been saved with good enterprise architecture? But I have to answer that by starting with some assumptions. Because if these assumptions are met, then the answer is maybe. If the assumptions aren't met, the answer is not maybe. The answer is now we wouldn't have had any impact at all. Okay, so number 1, assumption, EA processes are integrated into the decision cycles of the agency in question. Don't know that. But if they aren't, then I can tell you that I have all the answers, and if you don't ask me the question, I can't help you. Okay, so we have to be in the right room at the right time. Secondly, individual EAs have developed the trust of senior agency leaders. So if I tell Brian, that's crazy, and Brian goes, Nick, what the hell are you talking about? You lied to me last week. Well, then he's not going to listen again. Right? I know. It's because I've learned that a lot. So the reality is that trust matters. Because just like if I didn't trust my doctor, I wouldn't listen to his advice. If I don't trust my EA, I'm not listening to his advice. Third one, the enterprise architects have buy-in and access to the actual contractors. So I can work with the agency, I can tell the agency people, you should be doing things differently. They might even agree with me, but the reality is, those contractors are doing the work. And if I don't have access to what they're doing, how they're doing, where they're working, if I can't communicate with them openly, and as openly as a challenge, sometimes contracts get in the way, then it's going to be really, really difficult for enterprise architecture to have the impact it could potentially have. Let's assume that I have all those 3 things in place. Let's assume. Then, EA could have had some impact. Okay? Could have provided insights to predict decision and governance issues. So before the thing actually had gone completely off the deep end, we could have said, we've been noticing something here. No one's taking responsibility for this. We could have said that probably 3 years ago. Okay? That would have been a pretty good time to fix that. We could have suggested organizational governance mitigations. Hey, let's actually have someone take ownership. But more than that, let's make sure that we have the timing right. The timing of delivery is good. Because it wasn't just a matter of all the systems being done in a silo with a little bit of time at the end to integrate. What does that mean? That little bit of time was just too small, wasn't it? I mean, Chris was bang on right. The thing was doomed before it got to that point, okay? And it was doomed because somebody hadn't thought about this in time to fix it and get that timing right. Oversight and pilot the organizational governance changes. This is more than just saying, oh, I'm going to go help your program run. This is, I'm going to make sure that the people are communicating. So I'm going to run the communication team. I don't have to actually run the program, I'm not the program manager run the program, right? But I'm going to make sure that people are talking, that they're actually sharing the information, that they're actually having those conversations. Oversee the program about evolution to warn senior leaders of new issues, because things come up. Things come up all the time. Okay? And as my other case studies show, when things come up, if you're ready, no one ever hears that. If you're not ready, then maybe you weren't being very helpful to the team. So in conclusion, yeah, while other established project roles are capable and even tasked with providing some of this value, only enterprise architecture could have done all four. So could EA have solved the problem? I don't know if it could have solved it, but it probably could have had a very positive impact on the ACA role. Any questions for me?
Let's get into the Q&A just a second. Okay. I'd like to thank our panel members, especially Nick and Chris that flew in from the West Coast to be with us this week. I'd also like to, before we get into the Q&A portion of our program, I'd like to formally thank and recognize the MITRE organization. Charlie Martinez and Sheila Kane with us this evening. We have many members from our Center for Enterprise Architecture here this week. So for those of you that weren't involved, I'd like to give you an idea of some of the other activities that were wrapped around this event. Monday, we had an event scheduled for our master students. So our new online professional master student we have students from literally all over the globe. And we wanted to try to get them together to meet some of the faculty, meet one another. We had 60 people that were scheduled to come in, and we have about 200 students now in our program. So we have about 60 people to be here in person, the rest connecting online. Unfortunately, we had to cancel it because of the weather. But that was going to be held in MITRE's offices just a few blocks from here. Tuesday and the first part of today, we had our annual Center for Enterprise Architecture members meeting, also hosted by MITRE. We had about 70 people that were coming in for that meeting from literally from all over the globe. Some of the Europeans made it, some of the Americans couldn't make it. Actually, we have some of the Europeans in the audience today. And we had about 70 people coming in for that meeting, and roughly half made it, and the rest had flight issues. And then this afternoon, MITRE is funding and sponsoring an EA Body of Knowledge initiative, and I've been honored to be involved with that on the governing board. So this afternoon, we had a community meeting about that initiative to get some feedback on the work that's been done so far from the community at large. And then that meeting concludes tomorrow about 5 o'clock. So it's been a big week for the center and a big week for enterprise architecture. And our board members have been involved with us in all of these activities this week. So I want to thank MITRE again for their hosting of the events. Okay, now we'd like to enter into the question and answer phase. And I can imagine this is going to go quite a bit. If any of you need to leave, we're over where we thought we would be. If you need to leave, please get up and do so. But the panel's willing to stay around and answer questions. And John came into our center meeting yesterday to give a little preview of this session, and the questions went on and on and on. So I'm sure there's many questions. I have prepared questions, but I'm going to start with yours. So why don't we start with fielding questions from the group? And if you need to leave, by all means, feel free to do so. Sure. Okay. Good seeing you. So, okay. Is that questions? Please go ahead. Ryan?
So, my question is there any evidence or do we know with the ACA if there were any enterprise architecture techniques attempted during that program?
There was initial attempts for a basic architecture that was used for the data hub and the portal design, and that was also sponsored, and they funded initiatives and given innovation grants were given out. So New York got an innovation grant for it, a couple other states did, and all the states, and they defined interfaces for all the states' interfaces and defined interfaces for the insurance company. But one of the problems was they only assumed 5 states would go federal. If everything else was gonna go states. So numerous states built their own architecture, many of them following enterprise architecture principles. But then they said, "Ooh, we have to build this. The architecture's a nice paper. Let's go, and we don't have the risk. Let's send that over to the feds." So you go from 5 states starting to 36 states. So Virginia, Pennsylvania, they said, "Okay, feds, you build it for us." Okay, but so the number of states got smaller and smaller that were building their own. And in New York, there was an enterprise architecture that linked between both health and human services across all the areas. But many others didn't do that.
Okay, good. John, I thought you said, I mean, I'm on that 5 states versus 26 states. The way I understood your comment earlier was that CSC, you're with CSC, right?
Yeah.
That CSC bid on 5 states.
No, the other contractor bid on.
The other bid on, I'm sorry.
Okay, 5, and we bid on, actually.
How come the government didn't say you had to make this assumption? I mean, okay, because they didn't have an enterprise architect, but I mean, that's a basic idea of how many states are you going to have to support and how many.
Well, they said, when they saw the price,
They being the
the
government?
government liked the price, and he should have bid, in our back, on the feedback when we lost, they said, he should have bid 5. And we commented, we commented, well, we don't think that's realistic. And so they took the low bidder. And they were significantly lower.
So let me ask Kim then. You said that this ACA is not going to be an anomaly in the future. I thought you were talking about perhaps the government will look at better value as opposed to just low bid. Is that what you meant when you said that?
Well, yeah, I mean, there's that, and there's also the way the government does business in general, and understanding where their gaps are, and the fact that they don't really understand where the gaps are right now. And the
No, but
methods.
we didn't learn anything from ACA about how to fill those gaps, other than
We did learn a lot about how to fill those gaps. The problem is we need to make sure that the federal government is aware of what that means.
You
And the
learned how to
measures,
fill those gaps.
yes, and we learned the same thing in Medicaid 2.0 in 2005. It's a message that's been repeated, and the folks on the outlying side understand that, but as far as what the federal government understands, they don't, it's not tangible to them. They can't actually feel it.
The contract law really favors low cost, okay? And you have to make it a value-based purchase. You have to tell a better story. So one of the faults could be, I could have told a better story about, this is really going to be a mess. We tried to tell that story. And now last week, Marilyn Taverner, who's the administrator of CMS, she said at a healthcare conference in Orlando, we learned a lot about it. We should have had an integrator. We should have had more testing. We should have had a stronger governance process. She said, I have lots of other things we learned also. The acquisition process was flawed. So she went on and said many of those things. And will that change? And you would hope so. But I've seen this movie other times. It doesn't matter which. I've seen this in the 80s, the air traffic control system. And it doesn't matter. They're not very sophisticated buyers. But you need somebody that stands up to them and say, this doesn't make sense. Okay, the state of New York was putting out a procurement for the Medicaid system. We've been there since 1986. They decided to put an onerous contract on it that said if you were down for every day, you would be liable for every day Medicaid cost. Okay? Medicaid is a huge program in the bill, and we were going to be liable if it was down for a day, $500 million. We've been there since 1986. We said, we're not going to bid this. We've been there forever. And then another big company, starting with HP, another company called Xerox, said they weren't going to bid either. And then they said, well, we'll make it a little worth of a while, and have a longer period of development. They all did, it was non-compliant. But you have to, as an integrator, you have to stand up to them and say, this doesn't make sense. This doesn't make sense at all. And somebody has to stand up and say, hey, this is not going to work. But you're a company who says, and by the way, they backed, I wouldn't say back off. They gave us an extension recently, last week for $210 million.
You said a different thing. What you really said was that people in the government don't understand what they're paying for, don't understand the enterprise architecture, don't understand period. Is there anything that leads you seem to indicate maybe things will get better? I don't think they will. I mean, they had a yo-yo in the White House who was responsible for IT, and he appears before Congress, and he didn't know who did it.
Who, the guy from Microsoft?
No, yeah, probably.
Nice.
Steve
Thanks, I appreciate that.
Former Microsoft? Yeah, he's a
I
CIO.
always appreciate it.
I mean,
my point is, I mean, what's to learn? I mean, nobody's responsible. There's no enterprise architects. What's going to happen?
oh, there's an enterprise architecture named Scott Bernard, okay? And there is an enterprise architecture at the HHS and CMS. Most of them are compliant-oriented enterprise architecture. That's the problem. You need a strategic-oriented enterprise architecture that has a clue of how to do it, okay?
John, was Scott involved in ACA?
I never saw him
No.
engaged at all.
No.
Okay, and it is a bigger job than he has ever undertaken.
Can I jump in a little bit on this? And I think there's one of the things we got to look at is, it's very easy when you're among the trees to forget there's a forest, right? I've worked with a lot of government folks, both at the state and federal level, and I'll tell you this, I've never met a person who didn't want to do the right thing. I've never met a person who intentionally switched off their brain. Never one. What I can tell you, though, is that systems override people's behavior every time, right? If your behavior is, I want to pick the right thing, and the system says you're not allowed to, then it doesn't matter whether their behavior is meant for all the good in the world. The system right now, a lot of it is built into legislation, and a lot of it is built into business rules that come through normal government policies and practices. Some of it's cultural, right? But that system of decision making is not one that is easy for systems thinkers to work within. It's very siloed, it's often very program-based. The funding might come from political expectations rather than rational thought. And as a result, I'm not saying that I want to hold anybody harmless, but I'm not sure I would say I would hold the folks individually as intentionally screwing things up or failing to learn. I think what we need to look at is, let's take that enterprise architectural approach and look at the enterprise of government procurement and map that whole enterprise and clean it up. And everybody has to admit there's nothing good about the government procurement process.
GSA is responsible for government
Yes, they are.
procurement.
And Nick, I think that's well said. We have many constituents in the Center for Enterprise Architecture from the government, and like you said, there was a lot of frustration. A lot of people saw this coming from the government side. Now, when we were putting this panel together, I couldn't get anybody that was willing to stand up and tell their stories in a public setting. Privately, they'll tell you a lot of their frustrations, etc. But like you said, a lot of good people, but were frustrated for various reasons.
I want to finish this up with an observation I've made about people learning things. And that is, I've run into situations where situation failed, people, quote, learned from it, and then I ask them, okay, what are you going to do differently next time? We don't need to do anything different next time. We learned from this past experience. And and these are really, as Nick notes, really well-intentioned people, but the problem is you haven't really learned something unless it changes your behavior. But a lot of people think, all right, I learned from that experience. I don't need to do anything different because I learned from this experience, it won't happen again. And that's just not how it
It
works.
has to drive, the discussion has to start somewhere with a cultural change.
Yeah. But cultural change is the most difficult kind of change you can try to
It
affect
is
in
in
an
government,
organization.
I understand. good trust me, exactly right, and that's part of the frustration. And I think maybe Chris, in her presentation, intimated that maybe a debacle such as this might start a discussion on cultural change.
That's the hope,
I
yes.
really hope so, and that's kind of what I learned from the discussion. My second question is, how much of an impact does the burden of policy have, not just on the ACA, PA development, but on PA development? It's probably an inside development question, but how much of an impact does all of the policy piece have on the whole EA piece? Especially in the front end developmental timeline. It seems like there are always a lot of policy discussions. That's what I've experienced in my 10 years.
The law had dates on it, deliverable dates. And in the law, and so those dates became, and almost every law has these now. And so every law that's come out has these dates in it, and meeting those dates becomes sacrosanct. And so those are the hardest policies. Policies themselves aren't hard. It's the feasibility of getting those dates and getting the contract starting at the right time. They started that contract for healthcare.gov, the data hub, 9 months late. And they never got it. And they were 9 months or a year late of starting it.
But it appears that policy really gets in the way of the project.
Well, the acquisition policy gets in the way. Because they don't, and the decision about integration, the integration contract, that was obvious from the beginning. You read the statement of work. And it ebbs and flows of, you want an integration contract or you want the government to be responsible. And it doesn't seem to make a difference which party is in policy, in favor. It seems to be, we can do it ourselves, we don't need that, and it just shifts all the time. And the enterprise architecture stuff started under Clinton, and started with the National Performance Review, and everybody's sure that Bush would get rid of it. It continued. But it's gone up and down on as far as the meaningfulness of it. And sometimes I think it gets stuck in compliancy world. And that's where I think it's been, because it doesn't have a burning platform. And it needs to have that. And some of the people they moved in, they got rid of the chief operating officer at CMS. The CEO of CMS has been gone. A bunch of other people will be gone. That's one thing. Would you have wiped them out the day that it was occurring? Some people in business would, but they're going to leave them there to fix it. And they brought in Kurt DeBlane, who was the head of Microsoft Project Office.
It was Microsoft Project.
Yeah, third most money of anybody in the Microsoft or something like that. His wife's a congresswoman, so he got stuck with it. And he's going to try to fix it. But there's, so you bring in industry people and everything else, too late. And people knew this.
It was way too late for him to fix anything. At this point in time, now he's just going to pick up the pieces.
Yeah. And so people knew this in May and June, for sure, at the time.
We're going to give Sheila and Bob. You both had your hands up. Good.
Okay, so I really enjoyed all the talks, and I noticed that everybody was talking pretty strategically, and which I think is wonderful. So, but I wonder when you're asking the question, what enterprise architecture did they have, and how, if they had it, and how could it have helped them? And I asked this question to myself too. What the heck do we mean by that? When we say they need enterprise architecture, nobody talked about frameworks, nobody talked about we talked about principles a little bit, but I don't get a firm feeling, and I think as we evolve the profession, I think we all have an idea of what that is, but I don't think maybe this is my plug for the EA, I think that we need to, and everybody's working on that, what is it really? Is it the set of things we have to make? Or is it some recommendations or guidance? What is it?
I'm going to try to answer.
Okay.
Because I'm either daring or stupid, but make fun of it. I think enterprise architecture, having grown out of IT, has a lot of methods for looking at technology. Is this technology right? Is that technology choice right? Is this technology configuration right? What we don't have a lot of good methods for in the EA space are looking at program design, organizational structures, information flow among humans. We don't have a lot of good methods for that. Now the twist is, if EA were the world, I would say we're pretty novice. There's an awful lot of other fields out there that are pretty good at some of those things, including organizational development, management theory, leadership. There's a lot of other ways that people work. Even sales has a better job of understanding motivation for people than enterprise architecture does. So I think to answer the question, how can EA have helped, is for an EA to not be an IT EA, but for EA to be a organizational development EA, a process management EA, a person who looks at the human side and cares about it as much as they care about the technology side.
One other point is the EA has to have more than framework pieces. It has to have a concept of operation, which they had, but it was very complex. It has to assume that failures are going to occur. It has to build in resiliency. Because one of the problems was the data service output. Okay, everything fails. From the air traffic control system to everything. So you had to build in resiliency. So as I was building in resiliency in my proposal, the others were cheaper because they didn't have to do that. They didn't have to do failure tests. They didn't put a performance profile. We know the air traffic control system works on the busiest day of the year, right, Thanksgiving. We know the tax season. We should know, and we create a performance profile. They said they didn't need that. They have cloud computing now. Okay, so some of that, and Mike is laughing because he has a cloud computing symposium. Okay, so they think that there's magic now that's occurred with this technology. Okay, magic didn't happen. You have to plan for that, and you have to have. Innovation was going to solve it and putting smart guys in a room. But you have 55 contractors, nobody responsible. It's like, Penn State football with Jamie Franklin or anybody as a coach cannot solve it without a game plan. And they have all specialized teams, okay? And that's what they did. And so that is an acquisition program management problem. And some of that's above EA. It's really above EA, and it said, how do you do these rollouts? And so you get the policy wonks can't do it. Need program managers. And are you going to get better program managers? There's been lots of discussion about creating this cadre of government program managers. Are they going to do that? I don't know. I don't think they have enough money to do that.
What worries me is not whether or not they have enough money to do it, or whether or not they have smart people to do it. What worries me is, there's no evidence. And I'd love to see evidence that enterprise architects somewhere involved in the ACA actually made a recommendation to fix one of these problems before they occurred. I'd love to see that evidence, because it means that an enterprise architect was watching and they wrote it down. Because then I could say somebody ignored it, but I can't say somebody ignored it if nobody actually made the recommendation. So I would love to see the evidence that the recommendation was made, just to understand whether we have to fix something in enterprise architecture. Because I think we do. But that's just that's a bias, perhaps? Biased and uninformed opinion, and maybe that doesn't get me very far. Except it'll probably get somebody to write a paper.
I would totally agree with you, because a lot of times when we took a look at IB&B, because the federal government was supposed to have an IB&B vendor. And at some point, somewhere, somebody knew the name of the vendor. Being IB&B myself and on state projects, state-based exchanges, I never knew who the IB&B vendor for the federal government was. And it seems to me that there are a number of findings and a number of risks, because that's what we do, we're finding and risk-based, that would have been established by IB&B, it's either a matter of they weren't there, they were there part-time, or they just weren't integrated, they weren't heeded, they weren't listened to. And that could be part of the process and part of the problem with enterprise architecture. But I do understand what you're saying. It's hard to get that. It's hard to get to that place. And I think part of that is the work that people does in trying to understand what our message really is and where we're coming from and how to actually distribute that knowledge to other folks. Because EA does mean a lot of different things to a lot of different people.
And
So
feed-
we don't- I just want to add.
Go ahead, sure.
So we don't really know if they had an enterprise architecture that failed or they didn't have an enterprise.
Well, it did fail if you don't know.
Well, they didn't have one.
Well, we don't use the noun enterprise architecture, use the verb enterprise architecture. We don't know if an enterprise architect did the right work. We know there were people who had the title.
Right.
There were probably a whole bunch of documents produced.
MITRE had, by the way, had a significant role there.
Actually, it's a much smaller role.
My perception is,
No, we do not. No, we did not. We're in helping now. We did not have a.
then we have,
Absolutely, we did not.
okay, my contention is MITRE wrote lots of the statement.
Minor, no.
Okay,
Minor
but
was CMS on-
Maybe we should move on to the next question.
I've been to that office, and I know,
I know that office, and I know the people in Melbourne, MITRE did not. MITRE is helping now to fix it. MITRE
Okay.
did not.
okay, because that's what they went.
Help, but it was turned down.
Yeah, I did a search and couldn't find writer's name except for
Okay,
a small
okay.
security.
Well,
Yeah.
So now I'm excited.
It was the offer and they said no.
Right, there was a security.
So I have a comment and I have a long-winded question.
Yes.
Sorry, I apologize for that. So the comment is, Len brought something up that I think Nick somewhat addressed in his talk, and that was that when architects in architecting have gaps or do not complete their effort, it gives designers an opportunity to screw up solutions. Right? And that brought a thought to me that Nick somewhat addressed in that EA is not a fix. It's a life cycle process.
Right.
And there is accountability through the entire life cycle. And you can say that there was an enterprise architect, or you can say there was an enterprise architecture, but if it doesn't live on through the process and gives an enterprise architect an opportunity to say, you're screwing up throughout the life cycle, you failed. Right? So that's the comment, right? The question is, and this goes back to John and Chris's brief. Someone mentioned we were talking. One of you were talking about that ACA did not have the opportunity over 10 years that say the IRS had to fix their problems or to understand the issues they had to address. My first thought is I would not use IRS as a poster child and the right way of doing things. And we talked about things like the Big Dig was brought up. There's so many failures, over and over, project management and enterprises that are brought up. Can someone please? I'm a senior systems engineer, for lack of a better term. I am a big fan of ethical plagiarism.
Yeah.
I'm looking for best practices to reuse over and over again. Can someone please give me a good example of a major job that we can use as a good example to apply to these kind of things, like ACA? Because every time we have these discussions, it's always this failure and that failure. Where's a good example?
Well, that's actually why I tried to do some of that. Let me put in one caveat, and that is when you have very large releases of things, you're kind of lighting the fuse on the bomb no matter what you do. Big changes are very likely to fail. There have been some studies that show the size of the change is very close to exponentially proportional to the kind of failure likelihood. Up to, it gets to like 98% failure rates when you get above a certain size. So the number one rule is don't make big projects. And so a lot of little projects over time, and this, I'm sorry, I'm cutting off John,
Spoken like a true agile.
but there's something to that. When think about it, I'm talking about the 10-year time plan. Realize IRS created projects, got them 7 years going, and canceled them. Created another project, got it going for a couple of years, canceled it. Got another project going, went for another couple of years, canceled it. What actually started to have impact is a lot of little projects.
But they did, and the modernization plan had its ups and downs, but it did not ever miss a year-by-year date. And they every time your taxes went through, okay. The air traffic control system has worked. The traffic flow management brought every plane down on 9/11. Okay, the The space network that tracks satellites across the world has been up there for years and years. We know we have space, we have satellites for Earth observing, weather satellites. They have worked. We have drones that work. We have military things. But sometimes the politics get in. We knew of 9/11, that we were tracking Al-Qaeda before 9/11, but in May of 2001, it was shut down because of politics. Okay? A Republican vice president said there's no such thing as Al-Qaeda. It was working and it was tracking Osama bin Laden. It was closed down. Okay? It doesn't matter what party it is. They're stupid, factless-based processes. Enterprise architecture cannot solve stupid policy decisions. And some of this was stupid because it should have been, it would have been ideal if we had a pragmatic discussion of the health. And they had all agreed and said, this is what we need in the United States. And that would have taken another 10 years. It started in 1984, this discussion. So we have to get somewhere, and maybe that was wrong. Maybe the Affordable Care Act has some inherent problems in it. I know it does. Cost controls are not there. Tort reform is not there. But it started to move. And so I think there's some benefits to it. And enterprise architecture may not solve it.
I do want to make one other minor comment, and that is you mentioned a number of failures that are very visible because the reality is the government has to behave in the open. And we like that. I mean, it's better than Putin's Russia where the government doesn't have to behave in the open. I mean, it's messy, but it's better than not messy, right? The twist, though, is private business doesn't have to behave in the open. So for every failure that you see, and I work primarily in private business, okay, and I've worked for some very large companies. For every failure that you've seen in the public, where everything from not just the federal ACA rule, but my goodness, Oregon, okay, I just have to name the state. I don't think their exchange is running now.
No, I think they're still in paper.
I think they're still on paper. Okay. So I mean that's a pretty colossal failure as well. But for every time that you see one of these things that fails in public view, there's 100 that have failed for that same amount of money or more in private view. This isn't a problem of government. This is a problem of humans. Okay? And I do want to realize that enterprise architecture is there to help. But once again, we're the doctor. If you ignore our advice, you're going to get accurate.
What's the phrase about Churchill? Going from failure to failure and still keeping your enthusiasm? That's what we have to do.
You're permeating my issue. You know, I never mentioned government as the failure. Right? I never mentioned whether it was private or public. Right? I mentioned that every time we talk about failure. Talk about success.
We do hope to learn from it, but I think you're right. Examples of good behavior are helpful, but once again, the DNA of a bird is different than the DNA of a dog. I can say this worked in the case of the bird, but I can't say that's going to work in the case of the dog. And if two organizations are so different that their DNA is that radically different, I realize those two animals share over 90% of their DNA. So if I can say that and I can't cure a disease in a dog using the medicine of the bird, why can I say that a simple method or a simple answer in enterprise architecture is going to have that same impact? It probably won't. So there have to be humans involved, and we're going to make human decisions.
As much as I'd hate to do this, I think we're about to get kicked out of the room. This has been great. You can imagine what our Center for Enterprise Architecture meetings are like with a room full of people like this. Very interesting discussions. So the panel will hang around if you'd like to have some one-on-one discussions, but I think we're going to be asked to leave the room shortly. Thank you very much for hanging with us so long. We went way late, and I want to thank our panel once again for a great